Hello, everyone. It's a delight to be with you here at Keto Salt Lake 2021. And I'm here to talk to you about something I'm sure you're all interested in hearing about, which is COVID-19. I say that jokingly because I think we've heard enough about COVID-19 for one lifetime. But there's one story that needs to be told, and that's the notion that a ketogenic diet could help prevent bad outcomes from COVID-19. Now, this is a hypothesis, and I'm a scientist. So the short answer to this question is we don't know yet. So what we have to do is look at the scientific evidence that would support the hypothesis. And that's what the science says, and that's what I'm here to talk to you about today. These are my affiliations. I am an Associate Professor of Kinesiology at the University of the Fraser Valley. I'm a visiting scientist at the BC Cancer Research Center, collaborating scientist with Dr. Jeff Volek's team at The Ohio State University, and I'm on the scientific advisory board of the Canadian Clinicians for Therapeutic Nutrition. I think it's important that we declare our disclosures when we're speaking about nutrition science because so many people have affiliations that are for-profit. I don't. I receive no funding for any of the research I do. If I receive any funding, it's from my self-published book, BioDiet, with my wife, Dale Drury. This is a book that tells you the how-to, but also the why-to help you safely adopt a ketogenic diet. Our research is funded by the John and Lottie Hecht Foundation, which is based here in Vancouver, BC, which is my hometown. And that's a picture of John and Lottie Hecht, and we're very grateful to the foundation for funding our research. Our research is a 3-year study to look at the therapeutic benefits of ketogenic diets for women with metastatic breast cancer. That's my main area of research. But as I mentioned today, I want to talk to you about ketogenic diets and COVID-19. This is a rather complicated diagram, and I hope you're able to pause the video if you'd like and look at it in more detail. It's very nicely done. And it shows on the left there alveoli in your lungs, which are the microscopic structures at various different stages of COVID-19. Remember, COVID-19 is the disease. The virus is actually called the SARS-CoV2 virus. And you can see the SARS-CoV2 virus there in the center of the screen. And if you're exposed to the virus, you may or may not become infected. Infection would mean the virus is taking hold in your lungs and starting to multiply. And your immune system will try to prevent that from progressing to moderate illness, which is the kinds of sort of flu-like things that might occur for a few months and might persist as a long hauler. And what we don't want to see happen is it progress to obviously severe disease where you might end up in the hospital, perhaps even in ICU on a respirator, and heaven forbid, you might pass away. It is a cold virus that kills, so we do need to take it very seriously. And so the question is, what's your best defense? And I believe that vaccines aside, your best defense might just be a well-formulated ketogenic diet. And here's the story that I think supports that. This is a diagram from a very good paper that was in Nature Metabolism by Janelle Ayres, and she talks about all of the metabolic responses of the body to the SARS-CoV2 virus. And you can see what happens. That's the sort of level of the virus on the x-axis, and on the y-axis. On the x-axis, you can see time. So you get exposed to the virus, the viral load increases, that's when you become really contagious. You end up sick in the short term. You get a response. If it's a hyperinflammatory response, that can create some problems and some long-term issues we call sequelae. And hopefully you recover, but as we mentioned, sometimes sadly people don't. So there's kinds of these 3 phases that occur during really any respiratory viral infection. So again, this is another way of looking at it, the severity of illness against time. So initially you have this virus phase when you're exposed to the virus and it's multiplying rapidly within your lungs and your nasal passages and so on. This is where it's easy to pass it along, especially the new variants. And then secondly, it's in the pulmonary phase, it's within your lungs, and the lungs and the immune system will try and defend itself against virus. And that's the pulmonary phase. And then even after the virus is gone, this is often when the worst outcomes happen, because it's the reaction of your immune system and your body to the presence of the virus and the damage that the virus has done that often causes these poor outcomes. So I sort of have a little timeline here. You have an uninfected person. Here's the SARS-CoV2 virus, which is in the environment, as we know. And by the way, sadly, we're not through this yet. We've done a pretty good job on the first SARS-CoV2, but now these new variants, the B117, Brazilian, Indian, and there will be more. So we may end up needing to have vaccinations every year. We may end up with reemergence of potentially dangerous viruses. And again, I think your best defense against this, other than a vaccine, would be a well-formulated ketogenic diet and a ketogenic lifestyle. And I'll talk more about this later, but I do want that message to sink in that this, remember, vaccines come after the new variants arise, but you can protect yourself before they arise by maximizing and optimizing your metabolic health. And that's what a well-formulated ketogenic diet does. So if you do become infected, of course, the viral particles will end up in your lungs, your nasal passages, but it's the lungs where it does most of the initial damage. That's where it takes hold. And this is where our social interventions and our behavioral interventions, PPE, washing hands, wearing masks, social isolation, help prevent us from becoming infected. But it seems like, if there's enough virus around, eventually you will be exposed and you could become infected. And that's then when you might experience some moderate disease. And if you've had a vaccination, you might have experienced some of the symptoms of this, which I can talk about in a little bit. So now it's taken hold in the lungs and your innate immune response. This is the non-specific immune response or innate immune response. These are cells and chemicals, white blood cells and chemicals we call cytokines and chemokines and lymphokines, which help protect us from any invading particle. And it's called innate because it's not specific to the virus or the bacteria or the fungus. It's a generalized kind of response. And that's important because ketogenic diets can really help to optimize this innate response. And of course, if the disease progresses to severe disease, it can then infect other tissues. And that's because the receptor that the virus uses to get into cells is evident on epithelial cells in all these different tissues, in your brain, in your heart, in your kidneys, in your intestines, in your liver. And it can cause multiple organ system problems, which can lead to very severe disease. So hopefully our adaptive immune system, these are the cells and chemicals that our body makes specifically to counteract the virus. It's the same thing that the vaccines do to try and prevent this severe disease from occurring by neutralizing and destroying the virus before it can do that. So that's our kind of timeline that we're talking about today. And we'll see where ketogenic diets can intervene. And I'm actually going to start at the right side of this. How do we prevent a bad outcome? How do we prevent ourselves from being in the hospital or ending up on a respirator? And that's where I think there are therapeutic benefits for a ketogenic diet. But I'm going to take a step back first and talk about the general therapeutic benefits, and then we'll refocus on how this applies to COVID-19. So in my book, BioDiet, I talk about the axis of illness. These are the three major factors that are at the root cause of most chronic disease: obesity, which is recognized as a disease in the United States; insulin resistance, which is associated with insulin, but also an inability to regulate blood sugar; and inflammation. Now we're talking about chronic systemic inflammation because initially we're talking about chronic disease. And so if you have a diet that is regularly high in carbohydrate, this is a standard American diet. The abbreviation is SAD, appropriately. It's very high in carbohydrate. Most people eat way too much high glycemic index carbohydrate through processed foods and high sugar amounts. And that actually makes all of the three elements of the axis of illness worse. It creates obesity. It accelerates insulin resistance. It also increases inflammation. And once these things start, they all make each other worse. in kind of a trifecta that will eventually spin itself off on one or another types of chronic disease. And so those chronic diseases, you're familiar with, these are the diseases that tend to plague society, especially in the West: cardiovascular disease, cancer, diabetes, and Alzheimer's. And my research area is in cancer, but all of these other diseases too relate back to these same three factors. So if we can successfully address these same three factors through diet by reducing the carbohydrate, I think there's very good clinical evidence that you can reduce your likelihood of suffering from one of these chronic diseases by as much as 70%. So what could be better than that? It's always better to prevent disease than try and treat it after you have it. And that goes for COVID as well. A lot of this centers around insulin. It's an insulin-based model for obesity. And you can see here, this is from Jim Johnson's lab at UBC. They're looking at insulin. And if you have too little insulin, of course, you would suffer from diabetes. If you have a regular amount of insulin, it does its regular job, which is regulating blood sugar, but also regulating fats, regulating protein synthesis, energy storage, and so on, including cell growth. If you have too much insulin, that's also a bad thing. So like most things in our body, it needs to be in balance. And when you eat too much carbohydrate, you need to secrete excessive insulin in order to absorb that carbohydrate into your cells. So a high carbohydrate diet means high insulin in your blood. We call that hyperinsulinemia. And hyperinsulinemia will lead to obesity, cancer, aging, and insulin receptor desensitization, which is insulin resistance, as we showed in that last slide. So there's those three elements, two of them, obesity and insulin resistance, but also don't forget that aging is an inflammatory process. Cardiovascular disease is an inflammatory process. So let's not forget about the inflammation component of the axis of illness either. The health benefits, I'm sure many of you are already keto adapted and have experienced these health benefits. You've lost weight, your blood lipids have normalized. If you were diabetic, your insulin resistance may have reversed, maybe to the point that you don't need to take drugs anymore. You're experiencing less inflammation and the associated aches and pains and so on that go along with that. Probably all kinds of improvements in energy, stamina, and you probably just feel great. And as I said, there's loads of evidence to suggest that a ketogenic diet, a well-formulated ketogenic diet, which means it's balanced and provides all the nutrients you need. And that's what's in BioDiet. That's why I wrote the book, so people would know what a well-formulated ketogenic diet is. We know now, we have enough evidence to suggest that it will do a good job both preventing and treating most of that chronic disease. Some of it is still emerging. The work on my work on cancer research would be considered emerging. We don't have any conclusive evidence, but so far so good. It looks like it is a good adjunct therapy. But the question is, will it also provide resistance to acute disease like infections? And this is where I started about a year ago. I actually made a presentation at Low Carb Denver, where at the end of the presentation, I talked about the evidence at that time that supported the notion that a ketogenic diet might actually be beneficial. Since then, there's been loads of great research that have come out of some of the best research centers in the world to support that notion. And I'll summarize that today. I'd love to talk to you about it all day, but I only have a short period of time. So we'll just highlight some of the main areas, and I think it makes a pretty compelling argument. So can a well-formulated ketogenic diet improve outcomes? So in other words, will it prevent you from being in the hospital or ending up in ICU or on a respirator? And so there's lots of research, as I mentioned. I don't have time to talk about all of this today. Here's just some. Like this is literally weekly, if not daily. There's very good studies that seem to support this. I want to point your attention to the bottom right there. This is a paper by Janelle Ayers. It's excellent. It's in Nature Metabolism, talking about COVID-19 as a metabolic condition. And she never mentions ketogenic diets in this, but everything she talks about points to the notion that a ketogenic diet would be beneficial. So that's a really good one that I think is, it's pretty dense in terms of the science, but it's really comprehensive in terms of all the ways in which COVID-19 affects our metabolism. And then what you need to add is all the ways that a ketogenic diet can help prevent those conditions. We know that COVID mortality increases with age. And the main reason for that is as we age, our immune system experiences something called immune senescence, which means it just stops being quite as vigilant as it used to be. So those opportunistic infections, bacterial, viral, fungal infections, including COVID, have a better chance of taking hold. And because our immune systems aren't as vigilant and we're just not as strong and probably not as metabolically healthy, we have a much higher risk of poor outcomes by age. We can't do much about age. We can do a lot about your metabolic health through nutrition, and that's where the ketogenic diet comes in. So going back to COVID now and looking at that from a metabolic perspective, right from the start in China, there were studies to show that people that were ending up in hospital were pretty consistent. They were generally obese, overweight and obese, almost all of them. Hypertension was a common symptom. Diabetes or uncontrolled blood sugar, coronary heart disease, which remember is an inflammatory disease, were evident as well. And since then, we've learned a few other things. The major risk factors for a poor outcome in COVID-19 are obesity, the high blood pressure, high blood sugar, and dyslipidemia or poor lipid profiles. So when we get hyperinflammation from the virus, remember that first slide we had? What happens is that adipose, that excess adipose, that visceral fat, the stuff that's around your belly that gives you a pot belly, is actually really a poor associate for the immune system. In other words, it interferes with immune function. And it does so because of the types of cells, the increase in macrophage, the kinds of cytokines that they release. It tends to dampen the immune response. So that alone, just the obesity and the fat associated with that obesity, will diminish your immune response. So if you want to optimize your immune system, you need to focus on losing some of that excessive visceral fat. And of course, you've probably known for years that the best way to do that is through a well-formulated ketogenic diet. It's the most successful one, short-term, and by the way, long-term. There are plenty of long-term studies now that show that if you stick to it, a ketogenic diet will take the weight off and keep the weight off. This one is really interesting. This one came out not too long ago in Nature Scientific Reports. And it showed that of all the people globally that ended up having poor outcomes, so they looked at people that had mild COVID, which is the blue. They looked at people that had severe COVID and ended up in the hospital or the ICU. And those with severe, the difference was they had lower HDL-C, that's the high density lipoprotein, which is the so-called good cholesterol. So they had lower amounts of the good cholesterol and much higher amounts of triglycerides in their blood. So hold on to that, lower amounts of HDL and higher amounts of triglycerides in your blood. These are the things associated with the high carbohydrate, high sugar diet. Now, this is some work from the group at Virta, who have done some very, very good work looking at diabetes, but they measured like everything you could measure in the blood. And this is quite a complex diagram that I don't have time to explain to you today, but I encourage you to just go to the Virta site. They've got all their research up there. But notice there the triglycerides, the LDL, we won't talk about that today, but the HDL-C. So remember, people that have poor outcomes have high triglycerides and low HDL-C. And these are patients that have been treated for a year with a low carbohydrate / ketogenic diet. And you can see if it's going to the left of that center line, it's decreasing. If it's going to the right, it's increasing. And those triglycerides have decreased dramatically. For most people, it's actually more like 50%. It can be up to 70%. That's what I experienced in my blood work. And by the way, I've been keto adapted for 10 years and it's still staying the same. So as long as you stay keto adapted, you're good. The HDL-C, that increases on a ketogenic diet. That's one thing we see very, very consistently. A couple of other things we see as well associated with this are the C-reactive protein. That's a measure of the general inflammatory state of your body, your systemic inflammation. The HS is for high sensitivity C-reactive protein. So that's a proxy for how inflamed you are. And look how much that's dropped. Tremendous drop in inflammation. Remember, that's one of the three basic components of that axis of illness. And also blood pressure going down and blood sugar going down. The hemoglobin A1C is a measure of your blood sugar, and your blood pressure is dropping too. So these are other comorbidities, they're called, that are associated with poor outcomes. So all of these improve dramatically on a well-formulated ketogenic diet. And this is from Brianna Stubbs' excellent paper. It was in the journal Med. And it shows you, I don't have time to go through all of it, but it shows you in the darker gray all of the elements of the COVID-19 that affect those various organs. And it also shows you in the lighter how metabolic syndrome, which is a condition that involves that high blood sugar, dyslipidemia, high blood pressure, and mid-abdominal obesity, that effectively defines what we mean by metabolic disease. And T2D is type 2 diabetes, which is often a result of metabolic disease. But you can see how these line up, how what the virus is doing is taking advantage of our poor metabolic health to attack each and every one of these organs if it can take hold. So essentially, you can view COVID-19 as an infectious acute disease initially, but it acts like a chronic metabolic disease once it gets into your system. And if it acts that way, can a nutritional intervention then, which corrects that metabolism, improve your overall health? Of course it can. And so this is what this whole axis of illness will look at on a well-formulated ketogenic diet. You still have those same three elements, but now we've taken the carbohydrate out of the diet. And what happens when we do that is all those three elements are reduced. The obesity goes away. The inflammation drops, as we've seen. The insulin resistance improves, reverses or improves. And of course, that makes us much more resistant to chronic disease. So we diminish the chronic disease. Both the incidence and the severity of it is diminished if you adapt a well-formulated ketogenic diet. But it also now may well reduce the severity of the acute disease, COVID-19. In other words, if you get COVID-19 and you're keto adapted, the hypothesis is, and the evidence I've shown you, is that because the ketogenic diet improves our metabolic health, it greatly reduces your risk of a bad outcome on COVID-19. This is what we need to start telling people. I don't know why we're not having this conversation. COVID has shown us that if we're in poor metabolic health as a nation, and 75% of Americans are overweight or obese, diabetes is out of control, inflammatory diseases like cardiovascular disease and Alzheimer's and the like, they're all increasing because we're in poor metabolic health. And we have an answer, and it doesn't involve drugs. It just involves good nutrition. And this is, I'm going to read this to you because this is a piece out of University of Louisville, and I just love their first statement. Again, if you have more time, you can read the whole thing, but reversal of metabolic syndrome and improving the metabolic function of the population would remarkably improve the overall survival of the population. Isn't that what we're trying to do with the vaccines? And can't we do that also with a ketogenic diet? I think if everybody adopted a ketogenic diet, we wouldn't have to lock down anything. We might still have to observe all of the social things. We might still need vaccines, but I think we can keep people out of the hospital if we can convince people to improve their metabolic health. And that's really where we need to go. And that's the message that you need to tell your friends, your family, and everyone else you can. So that's about the worsening of the disease, the poor outcomes of preventing you from being in the hospital. Can it actually prevent the infection in the first place if you're exposed to the virus? And I'm going to talk about 3 or 4 different things. There's actually quite a bit here. This is a study that came out actually in the fall of 2019 out of Yale. And what they did, this was influenza A virus. And they have these mice, and they can give the mice this influenza A virus that is fatal to the mice. So they have a control group of regular mice, and then they keto adapted this other group. And by the way, it doesn't work with addition of exogenous ketones. You actually have to adapt the ketogenic diet and produce that beta hydroxybutyrate, the main ketone, internally to make it work. And so what happened was they basically put them on a ketogenic diet. They exposed them all to this influenza A virus. All of the ones that weren't keto adapted died. None of the ones that were keto adapted did. So they were looking for why, because this was a rather remarkable discovery. Now, it is about influenza virus, but remember, we're talking about the innate immune system here, and the innate immune system doesn't care what kind of virus it is. It's just a respiratory virus. And it is in mice, and we're not mice, but mammals have pretty similar immune responses from the innate perspective in this regard. So here, the consumption of a low carbohydrate, high fat ketogenic diet protects mice from lethal influenza A virus infection and disease. KD feeding resulted in an expansion of gamma delta cells in the lung that improve barrier functions, thereby enhancing antiviral resistance. So there's these kinds of T cells in the lungs called gamma delta T cells, which kind of have one foot in the innate immune response and one foot in the adaptive immune response. And it seems to be their activation is linked to the ketogenic diet, and that prevents the virus from actually getting hold. Now let's talk about the SARS-CoV2 virus. Here it is infecting some cells in the lungs. And when it does so, this is the virus here that looks like one of those little pickle balls. And those little blue things, that's the surface of a cell membrane. The little blue things are receptors. And that's kind of like a lock. And those little S proteins, those are the proteins that kind of fit into that lock. And that allows the virus to gain entry to the cell. So it has to bind to those receptors to get in. And that receptor is called the ACE2 receptor. ACE stands for angiotensin converting enzyme, and we have a type 1 and a type 2. It's the type 2 that's expressed on all of those organs I showed you earlier: the heart, the brain, the liver, the kidneys, the digestive system, but in particular the lungs, because that's where the virus first comes in contact with the cell membrane. And that's where it's looking for these ACE2 receptors. And this was a really nice study that was done, a short paper from a group in Italy that shows the ACE1 on the left, the ACE2 on the right. The ACE1 is the target for hypertension. There's ACE inhibitors you may have heard of. And so ACE1 does one thing. It causes vasoconstriction, inflammation, apoptosis, fibrosis. This is ACE2 causes the opposite. So they work antagonistically. And so on a normal cell, when things are in balance, you can see you have a regular number of ACE2 receptors. Those are the little hearts on the right side. And the COVID is the little spiky thing that's going to come up later. If you are not in good metabolic health and not keto adapted, what happens is that balance gets out of balance. That teeter-totter falls to the right. These are people that are hypertensive, high blood pressure, that have uncontrolled blood sugar, diabetes, that have coronary heart disease, heart failure, and other inflammatory related cardiovascular diseases. And what happens then when you downregulate that ACE1 due to your poor metabolic health, you end up upregulating the ACE2. That means you're expressing more of the receptors, more of the locks for those keys to fit into. So that makes it way easier for the COVID-19 virus, the SARS-CoV2 virus, to get into the cells in the first place. The contrary is also true. If you stay in good health, good metabolic health, you're reducing the number of receptors, you're reducing the opportunity for the virus to get into the cells in the first place. This is another study. This was actually the first SARS. You can see 2006, and they were looking at what would downregulate the receptor, the SARS receptor, this ACE2, you can see it there. And these are Vero E6 cells. So these are green monkey cells. Now, green monkeys are a really good proxy for the respiratory system of humans, because they're also primates, of course. And what they found, which is shown below, is that interferon gamma and interleukin-4, these are two of the cytokines I talked about, downregulate the expression of that receptor. In other words, when those are launched, you get fewer of the receptors, fewer opportunities for COVID to gain entry to the cell. So this is the interferon gamma, and you can see that diagram shows the number of SARS-CoV as interferon gamma increases. It drops almost to zero in some cases. So it doesn't express the ACE2 receptor at all if there's interferon gamma there. And so now I'm turning to one of our own studies that we did at the BC Cancer Research Center. We were actually looking at responses of cells to cancer. So we have a proxy for cancer, which is a herpes simplex virus and also an E. coli bacteria. And we actually take the white blood cells out of people. We have a group that was keto adapted, a group of normal people who are not keto adapted, normal, and then we take their white blood cells out of the blood. And we use a Luminex process. This is called immunohistochemistry. We actually look at how those cells are talking to one another when we challenge them with this virus and this bacterial challenge, which is a proxy for cancer. And so most of these are for cancer. But what I want you to notice here is that, again, there's that interferon gamma, which is upregulated when you are keto adapted. So we've seen this again, that it happens in monkeys, it happens in humans, and we know when it happens, it will downregulate those ACE2 receptors. As we know, we talk about ketogenic diets a lot. What we usually talk about is the one on the bottom left there, which is beta hydroxybutyrate or 2-hydroxybutyric acid, same thing, or BHB. It's actually a ketone body. The original that's produced is the acetoacetate, and that's mostly converted into BHB. BHB is a very powerful signaling molecule. It acts as an energy molecule. It can be burned. It's a signaling molecule that works like a hormone. And it also really affects the health of the metabolism of the cell, in particular at the mitochondrial level, which is really of interest to me. So that's BHB. And this is from Brianna Stubbs' elegant paper. And there we have BHB on the left there, inhibiting glycolysis. Now, cells that are virally infected, they need much more energy for the virus to reproduce itself, to release. So if you block glycolysis, you're actually taking energy away from the virus's ability to reproduce and eventually spread to other cells. There's BHB again on the far right. And it's inhibiting this thing called the NLRP3 inflammasome. It's a mouthful, NOD-like receptor protein 3. That's kind of like, if you think of the brain, the thalamus to the brain is kind of a central regulator of things going in and out of the brain. It's kind of a central regulator within the cell for the inflammatory process. And if you inhibit that, you inhibit inflammation both at the cellular level and the systemic level. And on top of that, BHB is also, through this HCAR2 receptor, known to downregulate tumor necrosis factor alpha, a highly inflammatory chemical, IL-6, interleukin 6, which is the one that's responsible for the cytokine storm that causes such bad outcomes and often sudden death amongst people infected with COVID, and IL-1 beta, all pro-inflammatory chemicals that are inhibited by the presence of beta hydroxybutyrate, the ketone body that's produced on a ketogenic diet. And this, and I have to apologize, this is also either from Isabella Cooper or it's from Brianna Stubbs, and I apologize, I don't have the reference there. But what it shows you is a summary. On the left, we have all of the stuff that we know COVID does, at both the specific cellular level and at the systemic level, all the way through from the gut, the brain. You can see the NLRP3 inflammasome and so on, all the bad things it does. And on the right, we have what all of the great things that we know that beta hydroxybutyrate or BHB does that counteracts all of those negative aspects of COVID infection. So that's a pretty nice summary slide and a pretty compelling argument in and of itself. So can a ketogenic diet improve COVID-19 outcomes? Well, the science right now says maybe. And the reason we say maybe, even despite all this compelling evidence, is that we haven't done the experiments yet. And there'll be difficult and challenging experiments to do. But I think what you do is you look at the balance of probabilities and the weight of evidence in this case. So I've done that on this summary slide here. We're going back to the notion of here's what the science says if you've been infected, if you have moderate disease and trying to prevent severe disease. And here's where a ketogenic diet, I believe, has a strong, you can make a strong argument that it's a good intervention. So in preventing moderate disease, we have the downregulation of the ACE2 receptors from multiple angles. We have a downregulation of that IL-6 cytokine storm, which is what causes a lot of the sudden pneumonia and ARDS, adult respiratory distress syndrome. We have a downregulation of the NLRP3 inflammasome, downregulation of glycolysis, also inflammatory, and upregulation of both the alpha and gamma interferon response. If you've had a vaccination and that day or the next day you felt quite sick, you felt like you had fever and achy and maybe a bit of nausea and so on, that's actually the upregulation of that interferon that's causing that. It's not the virus, it's the reaction of the virus. And this is a good thing. It means you're having a good viral response. What you want in COVID is to have a good type 1 interferon response, and that prevents the cytokine storm from happening down the road. And also in that mouse study, an upregulation of these gamma delta T cells, which are, again, responsible for the protection of the epithelial cells within the lungs. And there's more. I just didn't have enough time to show it all to you today. On the adaptive side, to prevent the really bad outcomes, we know that ketogenic diets reduce obesity, reduce insulin resistance, and inflammation. Those three elements of the axis of evil, of illness, evil too. It reduces blood pressure. It moderates blood glucose and blood triglycerides. Super important in terms of moderating those outcomes. Reduces blood insulin. almost everybody that ends up in the hospital has hyperinsulinemia, and that's what's related to a lot of these metabolic problems. And it increases your HDL. So that's the balance of most of the good research that we've come up with in the last year that would indicate that it's a good way to start is to improve your metabolic health, because it improves both your innate immune response and your adaptive immune response. It may prevent you from getting sick from COVID. It will almost surely prevent you from ending up in the hospital if you do continue with it. So what better time to start than now, especially if you're still waiting for your vaccine. But even if you get vaccinated, it's not over yet, folks. There may be a new variant coming along. If it's not COVID or SARS, it might be influenza. So you really need to start now if you haven't already. So thank you very much for your attention to my talk today. This is my book, and I'll be available to answer questions after the talk today. But if you'd like to get to me later, or if you don't have time, or I wasn't able to answer your question, you can get a hold of us through our website, biodiet.org, and that's either of those email addresses, and there's our hashtag for BioDiet book. So it's been a pleasure to be a part of the great lineup that they have here at Salt Lake City, Keto Salt Lake City 2021. It's been a pleasure to talk to all of you. I look forward to hearing from you. And if you do happen to pick up a copy of my book and you run into me one day, I'd be delighted to sign it for you. Thank you.